My name is Dr. Suresh Kumarasamy. I'm a gynecologist and gynecological oncologist, and I hope to share some information about cervical cancer with you. Cervical cancer is a tumor that arises from the cervix and can spread to other areas in the body. Cervical cancer, fortunately, has a precancerous stage called CIN, or cervical intraepithelial neoplasia. It is possible to detect this precancerous stage and treat this very effectively, thus preventing patients from getting cervical cancer. When patients have suspicious symptoms or an abnormal pap smear, which is done as a screening test, these patients are often referred for colposcopy. Colposcopy is a simple examination in which the cervix is examined by an instrument called the colposcope. The colposcope magnifies the cervix, and we are able to pick up abnormal areas and biopsy these areas, thus confirming whether the patient has cancer or precancerous lesions of the cervix. Cancer of the cervix is treated by a number of ways. Cancer of the cervix may be treated by surgery, it may be treated by radiotherapy, and also by chemotherapy, as well as targeted therapies. Surgery is the mainstay of treatment of early cancer of cervix. The operation that treats early cancer of the cervix is called a radical hysterectomy and pelvic node dissection. Cure rates for early cancer of the cervix are above 90% by using this operation. In patients who have certain negative factors after a radical hysterectomy is performed, some of these patients may benefit from radiotherapy or chemotherapy. The proportion of patients who need radiotherapy and chemotherapy after radical surgery is very small. Patients who have slightly more advanced disease are usually treated by a combination of radiotherapy together with chemotherapy. This is called concurrent chemoradiation, and the treatment takes about 4 to 6 weeks. In patients who have advanced cancer, where there may be spread of the cancer to other areas of the body, like the lung and as well as the liver, benefit from having chemotherapy. Cervical cancer can be prevented by 2 methods. There is now a vaccine called the HPV vaccine, which is very effective in preventing patients from getting cervical cancer. This vaccination is usually recommended for young girls starting from the age 9 years onwards, but it can also be given to women who are older. The new vaccines against cervical cancer can prevent up to 90% of cervical cancer in women who have not been infected by the HPV virus. The other method of prevention, as mentioned earlier, is by screening. The test to prevent cervical cancer is a screening test called the pap smear. And in this test, cells are taken from the cervix and studied under the microscope. And precancerous lesions of the cervix can be detected, and these can be treated very effectively before a patient gets cancer of the cervix. I hope this information has been useful for you. Remember, prevention is better than cure, so getting HPV vaccination as well as regular screening will prevent many women from getting cancer of the cervix. The few patients who get cancer of the cervix can be treated effectively by modern methods of treatment. It's important that a patient sees the correct doctor and should be treated by a doctor who is specializing in treatment of cancer. And for gynecological cancers, the specialist who treats gynecological cancer is called a gynecological oncologist.